Okay. You are a non-transporting basic EMT ambulance. You are dispatched to a residence of a 44-year-old female complaining about abdominal pain.
Okay, I've got my PPE. Is my scene safe?
Your scene is safe.
Okay. All right. What is mechanism of injury?
Abdominal pain.
Okay, so that's nature of illness. Is this my only patient?
Yes, this is your only patient.
Okay, I'm going to request additional EMS. Is there any trauma to the head, neck, or spine that I need to be aware of?
No, there is not.
Okay. All right. So what is my general impression?
You find an obese female laying on a couch with her knees drawn up with withering pain.
Breathing. Okay. Hi, ma'am. I'm Erin. I'm an EMT with Magic Valley Paramedics.
Hello.
What's the level of responsiveness?
She greets you as you walk in the door.
Okay. What's the chief complaint?
Right upper quadrant abdominal pain.
Okay. Okay, I'm gonna go ahead and assess their breathing. Do we have equal and adequate chest rise?
Yes.
All right, and what is her breathing rate?
20 RPM.
Okay. All right, I'm gonna go ahead and assess her circulation. What is her, is there any bleeding, major bleeding I need to be aware of?
No, there's not.
Her pulse?
A strong regular pulse rate at 110.
Okay, and I'm gonna assess her skin. What does that look like?
It's pale, cool, and clear.
Okay, after this circulation assessment, I am going to administer a non-rebreather. Ma'am, I'm going to go ahead and put this on you. This will help you get a little more oxygen. Does that feel comfortable? Okay. Okay, I'm going to go ahead and put this patient as a priority for transport. Okay, ma'am, what were you doing when this happened?
Oh, sorry. Just finished lunch.
And is there anything that makes it better or worse?
Worse upon palpitation.
Okay, so it hurts when we push around. So in this area over here, it hurts most. Okay. What's the quality like? What does the pain feel like?
It's dull and achy.
Okay. Is it radiating anywhere? That means is the pain anywhere but just the abdominal quadrant?
Yes, it is going up towards my right shoulder.
Okay, so it's radiating up to your right shoulder. What's the severity on a scale of 1 to 10, 1 being you feel just fine and 10 being in extreme amounts of pain? What is your pain scale?
It's about a 10.
How long has this been going on?
About an hour.
About an hour. Okay. Do you have any allergies?
I'm allergic to penicillin.
Okay, penicillin. Any medications you're currently on?
Novolog and Humalog.
Okay, and then any previous health history that I need to know about?
I have diabetes.
You have diabetes. Okay. What was your last oral intake?
I ate 2 Whoppers, fries, fried chicken, and a Diet Coke.
Okay. And then events leading up to this illness, was there anything?
No, I just finished lunch.
Okay. Okay. I'm gonna go ahead and, given the signs and symptoms that I'm seeing, I'm gonna go ahead and kind of do the GI tract, kind of assess around in there. I'm also going to assess the cardiovascular system and the pulmonary system. Go ahead and take a deep breath. Okay, everything seems to be, outside of the pain in the abdomen. We're going to go ahead and I'm going to take a blood pressure. Ma'am, I'm gonna go ahead and take your blood pressure really quick. I'm gonna put this on your arm. That's gonna give it a nice little squeeze. Okay, what is my blood pressure?
Your blood pressure is 160/90.
Okay, I'm gonna go ahead and take your pulse, ma'am. Okay, what is my pulse and respirations?
Your pulse is 110 and your respiration rate is 20.
When was the last time you took your blood sugar? Alright, let's go ahead and I'm gonna call medical direction and see if we can do a blood glucose test. What is the blood glucose test at?
150.
Alright. Okay, so my field impression is we have a 44-year-old female that is overweight, complaining of upper right quadrant abdominal pain that is radiating up to her right shoulder. It did just start occurring after she had a pretty heavy lunch. I'm going to, for interventions, I've already done oxygen with a non-rebreather at 15 milliliters. We're going to go ahead and wait for transport to come. I will be reassessing you about every 15 minutes to make sure everything's still good. My report is I have a 44-year-old female that is complaining of upper right quadrant abdominal pain that's radiating up into the shoulder. We have done oxygen rebreather at 15 milliliters and she is ready to be handoff or transport.